Guten Tag and good afternoon. It's about the extent of my German, so good to meet you all. I'm Miri. I'm the Executive Vice President and Chief Digital Information Officer for Baptist Health. Thank you for getting the slides up. All right. Thank you very much. I'm going to talk to you a little bit today about digital transformation. One of the most important things that we do as CIOs, and I've seen this even over the past couple of days with site visits here at Bolcom and other places, has been how to unlock value, meaning how do you help your physicians, your nurses, your administrative folks become much more adept in using technology to help? And also, how do you work with your vendors to ensure that you're actually getting what you're supposed to, whether it's with AI, whether it's with a KISS, or we call them electronic health records, whatever it may be. And that partnership is this role, but it's leading your organization through transformations, how you make it happen. So for us, it requires how to rethink how you deliver care, rethink how you make information secure, rethink how people think about privacy, how your patients engage. And as John was just talking about from a child perspective, we think about it on the entire continuum. We have adults, we have pediatrics, we have elderly, and Baptist Health, we take care of everybody end to end. So it's a much bigger part of the population in Florida to ensure. So it requires to be thinking about what's going to happen in the future and ensure that overall that we are transforming care. So how do we do that? Right? Couple of ways. Right? We look at digital transformation through multiple lenses, as you see here, right? It's multidimensional. It's holistic, meaning it's the entire ecosystem. It's integrated, meaning our systems talk to each other, work with each other, work with our patients, work with our clinicians. It's dynamic, meaning that it can change given its condition to make sure your IT systems can handle if there's a pandemic or whatever happens, or in Florida when we have very bad weather and storms. And then iterative, meaning you're constantly improving. Ensuring your mindset's the right way helps move for the forward and move to be thinking different. It ensure that at the end of the day, what you have is a big package of wins to transform care going forward. So some tools, right? What's important? A lot of you have asked me over the past couple of days, what are the tools you use to really ensure transformation? Okay, a couple of things. Number one, cloud. I've talked to several of you about this, right? Ensuring you the right partners in leveraging compute ubiquitously, whether it's Amazon, whether it's Microsoft, whether it's Google, it doesn't matter. It doesn't matter the vendor, but ensuring that you're doing this smartly and securely, and it's GDPR compliant. Two, platforms, partnering with the right tools and technology vendors to make sure you have a suite of products, not just one piece of the puzzle, but to ensure that you move forward systemically and dynamically. Three, operations, making sure you can deliver what you say you're going to deliver. How many times have you talked to a CIO who said, I'm going to do this, and they can't get it done because they don't have partnerships? That's where each of you come in to partner with the CIO and partner with the organization to make that happen. Analytics, seeing the data, which I've heard so much about over the past couple of days, particularly in the site visit to Bolcom yesterday, right? Or the day before yesterday. How can we see in the data what's happening? And then governance. I think you heard this from John earlier, the importance of governance and the importance of making sure that as you move forward, you're doing this in a unified and transparent way. So for us, we look at a couple of things, hybrid infrastructure as being an important component of things, right? Ensuring that virtual care, our platforms, our Internet of Things, which I've heard many of you are developing solutions on, right? Our information systems platforms, all of these have to tie together. But again, at the middle of all this is being able to see what happens. That analytic strategy is critical at unlocking value and ensuring you're moving forward. This is our actual cloud strategy at Baptist Health, right? You can see the red, meaning we haven't gotten there yet. The yellow, meaning we've done a decent job. We're still working on it. Green, meaning it's completed. Now, when I say completed, meaning it's completed for now. We're always updating and modernizing. How do we govern things? How do we manage things? How do we deal with AI operations, meaning automated AI operations behind the scenes, meaning I don't need to have people to reboot a server or reboot a computer or deploy a network switch. It can be all done via AI, and that's what we're working on. So for us, it's our actual roadmap. And this is how we communicate to the organization all the pieces of just, in this case, just security governance, and just ensuring that in this whole component of what we're doing, that folks know where are we on this journey. That communication is very important. So getting that platform ecosystem is everything that we do moving forward to digitally transform healthcare. But look at what I have here bolded. Finding the right partners is critical. You cannot do this alone as a CIO. You cannot do this alone as a hospital system. You cannot do this alone as an independent state within the United States of America. You have to work with your vendor community. You have to work with each other, right? Organizations like Chime and Schneider Fabrik, others that bring together CIOs and digital leaders to work through these problems is a key component of making this happen. Let's talk about analytics for a second. For us, we break it up into a couple of domains here. One, proactively monitoring impact, right? Looking for opportunities and actionable data. It seems like this is common sense, but you'd be amazed at how many folks don't even realize how much power is at your fingertips with the data that you have. And so many hospital systems and healthcare systems have an avalanche of data they don't know what to do with. They actually don't know what's the value there. How do I maximize that? That's where you come in to help answer and help us answer what are those questions that we don't even know we have issues on. How do we deal with these things? How do we make sure that we can find areas of prioritization and opportunity? This is our actual data warehouse, very high level picture of the way we think about data and the way we transform with data into gold tables and bronze tables. We spend a lot of time on our data analytics and infrastructure because this is the underpinning for artificial intelligence at Baptist Health, which we'll talk about in a minute, is having good data, having governed data, having secure data. Also making sure that the data that we have was collected with patient consent. I often tell my teams, do not be creepy with data. Don't. Make sure people know what you're doing with it. So this data warehouse strategy that we put together over many years has allowed us to unlock value for our area of the country that we didn't know we had issues on as before. For our framework of governance looks just like this, right? We allow the business to make IT decisions with IT. IT does not make decisions for the business. We make it together with the business. And if you see, we're always growing. We're always growing work groups because healthcare is changing at a very fast pace, particularly in the United States. And just like here, the government writes a new law, you have to react to it. You need a new work group, right? It happens all the time. So for us, we look at all the different dimensions of the business, say, how can we manage together with them, not to them? The process itself, right? Again, seems common sense, but aligning, engaging, and executing, ensuring that for us, we hold accountability to ourselves and to our patients to deliver the best possible care. But for us, it's always asking the why and ensuring that as we do something, it's not just because it's a shiny toy. It's not because some vendor just said, hey, go buy this and I promise you it'll work. It's actually ensuring that we knew what we were going for. We spent a lot of time unpacking what is the problem we're trying to solve based upon the data that points to says there's a problem with whatever it is the issue is. Let's talk about some priorities and examples here, right? For us, Florida, if any of you know Florida, you know for beaches or Mickey Mouse or Disney World. But one of the worst things about Florida is that we have a major issue when it comes to human trafficking. And what's interesting is I had 2 years ago, a bunch of physicians and nurses say, Aaron, not only do we have a problem with human trafficking, we have a problem with pediatric human trafficking. I said, you got to be kidding me. This is horrible. Isn't there something to fix this? No, there's nothing. I said, come on, there's got to be something. We looked, nothing. I said, well, then let's build something. Let's build an AI application to help look at patients as they walk in the emergency room and say, could you be a victim of human trafficking or not? And so we said, okay, let's build it. And this is the actual model we built. We actually built an AI model to say, let's look at what happens when you present and say, can we pick somebody out? And can we actually have AI say, hey, you know what? Aaron may be a victim. Let's pull them out. Let's make sure that they're good to go. We've been live now for about 2 years. We've saved over 1,000 people or recused them, as they say. You don't know you saved them until they do the investigation. But this was done with AI. We built this algorithm in 3 weeks. For some of you who know the KISS vendor Epic, right? It's an electronic health record in the United States. I believe they're coming to Germany or they're here now and installing at Charité, I believe, in Berlin. I gave this model to them and said, give this to every one of your customers. So Charité in Germany will have this AI model that we built in Jacksonville. That's the power of what you can do when you work together. That's the power when you look at your data and say, I have a problem. That's the power when you work and say, hey, we can solve a very complex problem if we believe in the outcome and the solution. And we know exactly where we want to go together. And in this case, in a very terrible situation, we did this for pediatric kids. This is our actual statistics of how many kids walked in my hospital in the past. This is, I think, to the end of last year. Every one of my hospitals, you can actually see the numbers of how many children, these are children, that the algorithm fired and were recused. Now, for any of you who are clinicians, you may know that there's so many different variables, right? Speech, bruising, patterns, but the AI algorithm took all, which I just showed you on the first page, took it into account. So my point here is this is what making a difference is in healthcare, is when you stop and think about not just, yes, servers and infrastructure are important, cloud's important, AI is important, but make a difference. Do something. Do something for your caregivers. For us, the other thing we focus on heavily, and I'm giving you just some examples here, is really ensuring that we help reduce clinicians at the computer. Too much bureaucracy in the United States right now in healthcare. Too much coding, too much worrying about billing and operations. The physician nurse is meant to be a physician and nurse, to be with the patient. So we said, can we reduce their burnout? And so we did. We started deploying AI to summarize notes and to summarize what's happening within the actual chart and all the inpatient course notes. These are exact metrics of what's happened. We reduced time, you see, significantly, right? With and without. Without's the blue color, dark color. Green is with. Look how much time we saved with simple summarization. This is real data. What's actually happening. So you can transform care. You can transform care for people showing up in an emergency room. You can transform care for your clinicians, and you can transform care for your region and your community. But you have to do it together. You have to work on these things together. This is another example. We also want to make sure we are responding to our patients. Our patients love to message us all the time. What time is my appointment? When can I get a refill? Et cetera. You don't have enough people to answer these questions. And imagine if you're that patient needing your medication and you're waiting for days to get a response, how frustrated you are. Well, AI can respond to simple things. So for us, we went after non-urgent medical questions, prescription questions, test result questions, right? Visit follow-up questions. AI can answer all of that. A large language model can do that. And this is the actual data to show we had over 700, almost a million, 750,000 requests within a 1-year time period. Okay, you can respond with AI. And it looks like this. This is an actual screenshot in our test system of what the AI message on the bottom looks like. And the clinician can choose to send it or not. Very similar to how sometimes email, like Gmail, if you use Gmail from Google or others, will automatically try to build a response for you based upon how you answer. You can do the same thing in electronic health records, but it takes time. It takes your physicians and nurses saying, this is how I want to respond to the patient. So it doesn't sound like a robot. It actually sounds like a human because that patient is scared. They're worried. They have a question. They don't want a robot. They want a human, but you can't get to them otherwise, but AI can. We also use technology to help with ambient dictation in the rooms, right? We use it to make sure that the physician is and the nurse is not having to type as much as they need to. They still look at it and say, yeah, that's true, but it takes them away from the keyboard. This is actual data and we did an emergency room. We looked at emergency room specifically for a quantitative and qualitative analysis. Is this really making a difference for our emergency room? Just the emergency room, just to see what happened, right? Press scanning is patient satisfaction. Look at that patient satisfaction score, 4.7 versus a 4.58 on a 5-point scale. Quantitatively, we could show over hundreds of thousands of visits. AI made a difference, right? We're saving 37 seconds in every encounter. Think about the course of a day, how much time you save using AI, but we had to do it together. This is the nurses. We rolled out AI for nursing so that they're talking into a microphone versus anything else. Imagine your nurse. Imagine you're in the hospital bed and a nurse is just talking to you versus them at a computer not looking at you. Look at how much time, 2 hours saved per nurse shift. Imagine you told a nurse, I'm going to give you 2 hours of your day back. This is real data. This is actual data to show what AI can do for you to transform and digitally transform your entire environment. But you have to do it together. We were the first health system to go live with this product across America. It made a huge difference for nurses. In fact, they can't get enough of it. They want more. They want to do more with it because it's saving them time and letting them be back to nurses versus scribes typing in a computer. I'll close with this. What got you here won't get you there. Meaning, you have to think different. You have to believe different. You have to work together with an ecosystem of partners to make it happen. You have to partner with other health systems, other vendors, other ways of thinking to change the mindset to do something different. Because that is the only way we make a difference, and why a large number of us came from America to learn from you, to learn what's Germany doing, what are other countries doing. And we invite you to do the same and come learn for us, because what got you here is today. Thank you.